Hi everyone, you're listening to Let's Psyconnect. This is LT.
And this is Ronnie.
You might actually be watching us, and if not, you can go ahead and join us on Instagram. Our handle is Let's Psyconnect, all one word, lowercase. We have the pleasure today to speak with Dr. Dixon. We are going to be talking about grief and death. We're going to be talking about all different sorts of grief. So to create a better understanding, raise awareness, improve our critical thinking and skills when it comes to addressing this topic with our clients, but also for ourselves, because we also have to think about the process that we go through too, so that again, it's not just a personal growth, but also professional growth. We have lots of questions to ask Dr. Dixon, but before we get started, let's have her tell us a little bit about her journey. So Dr. Dixon, if you can share a little bit about your journey, so what makes you so passionate about this topic, because you have been, most of your career, I guess, has been focusing so much on this topic, in addition to others too. So, which is again one of the things that draw us to you, because we wanted to learn from an expert. So tell our listeners about your journey. So how did you get here?
Well, first, let me say thank you for having me, and thank you for having me to talk about an issue that I feel like doesn't get talked about nearly as much as it should. So again, my name is Dr. Patricia Dixon. I'm a licensed clinical psychologist, and I have a practice where I see children, adolescents, and adults, primarily adults and adolescents. And in addition to that, I'm a professor of graduate studies. So I work at a graduate school program called the Florida School of Professional Psychology. And I teach a variety of courses, one of which is death, dying, bereavement, and loss. And given just my own experience through grad school, I recognize that a lot of the courses that I took didn't discuss loss in depth. And not only did they not discuss it, but didn't talk about how conceptually the experience of loss is interwoven in just about every client that you will see in the future. So that's one of the reasons why this topic is important to me and of interest to me. And then the second reason is, my own experiences with loss. That's something that we all have variations of. And so for me, knowing my experience with loss helps me connect to other people's experiences of loss as well.
Sure. Thank you. Thank you so much for sharing that, Dr. Dixon. And I want to start right with how your interest sparked, right? You said that in your own training, it wasn't something that was brought up a ton, and something that wasn't a conversation, which sparked your interest, right? So building from that, I want to ask, why do you think it is such a taboo topic, just in the general population, not even in the clinical sense?
Well, let me say, what really sparked it, and I didn't even think about it until right before I was about to go off to internship, I needed another elective course. And this course was being offered. And I've been somebody who's always been willing to talk about death in particular. And so when that course was offered, I had the opportunity to take it. And it was in that moment that I realized how much I had missed throughout my graduate school training. And so when you ask that question of why do I think it's such a taboo, I think it relates to various existential and humanistic issues, one of which being that many people fear death, which is fascinating to me, because there's so much in life that we don't know, that we have so much uncertainty to. But the one thing that we do know is that everyone at some point is going to die. And so it's fascinating to me that the one thing that we can have certainty of is the one thing that many, if not most, fear.
Wow. Wow.
And it's just, I remember talking to a few people at different moments of my life about death, either because I had lost someone or talking about death in general. And then people would be like, I don't talk about this. So, what do I talk to?
And I think that people don't want to talk about it because it's uncomfortable. One aspect of that discomfort, particularly when it comes to death, because there's various types of losses, but particularly when it comes to death, people don't know what to say. And so because they don't know what to say, they avoid it altogether.
And one thing that comes to mind is that when people apologize. So they say, I'm sorry for your loss.
Mm-hmm.
And I think I go back and forth because like when I'm talking to somebody in Portuguese, I don't say I'm sorry. I'm not apologize for their loss.
Mm-hmm.
But in this culture, we hear that a lot. So I don't know if you have come across your patients or clients, like individuals in your life that say, why are you apologizing to me? You know,
Mm-hmm.
why are you saying that?
And I think that's the experience of many, because people say, I'm sorry for your loss. And I think it comes from a genuine place of being really sorry for their hurt and for their pain.
Mhm.
But it's a cliche saying of, I don't know what else to say, so I'm just going to say, I'm sorry for your loss.
Right.
And I think when the person is grieving, hearing that is empty for them.
Sure.
And so I've learned better responses tend to be more authentic responses, which is, I don't know what to say. I'm here for you in any way that I can be. I know that there's nothing that I can say that will take away this pain, because the reality when it comes to death is the only thing that would take away that pain would be that person coming back.
Mhm.
And so the I'm sorry for your loss comes from a good place. But I think a lot of times the grieving person, because they know it's coming from a good place, simply say thank you. However, internally are experiencing this thought of, unless you killed the person, what are you sorry for? And experiencing this feeling of, I'm sorry for it too, but that's not anything that takes the pain away.
And I think just with that, it creates this confusion in people's mind. I mean, what am I saying? How do I talk about it? So why is it important? Why should we talk about that?
Mm-hmm. Well, excuse me. I think one of the reasons is because it is something that we all experience. And by not talking about it, there ends up being a lot of built up pain.
Mhm.
And it's not as if not talking about it makes the pain go away. In fact, it causes it to linger. And so a lot of times when people feel like, oh, it's too taboo to talk about, they're going through the pain of that loss by themselves. But if we become a culture that becomes more open to discussing the pain of loss, people are given and afforded the opportunity to process what's going on and then feel validated when they find out other people have shared experiences as well.
Definitely, definitely. And Doctor, you bring up the idea of different cultures. I was just wondering, just from your experience, what are some ways that you've seen different cultures experience loss and grief and death?
And it does vary from culture to culture. You know, there's some cultures where if somebody becomes a widow, they will grieve for a year, or call it grieving for a year, where they may dress in black for that entire year. There's an entire year of prayer and mourning. I know there's some cultures where if somebody's buried at a gravesite, you visit that gravesite weekly for a year. There's some cultures where it just varies from culture to culture. There's some cultures where there's the one thing that's consistent across cultures is that there tends to be some sort of ritual or ceremony that it fits them personally. But there's been a number and a variety of the way in which people handle death. And I think that it's incredibly important to recognize the cultural element when you're providing services. Because there's sometimes where we have this assumption that the way somebody grieves or the way somebody handles death and loss should be the way that we do. And so if their grief doesn't look like ours, we might not recognize it. And so if somebody's like, oh, for this entire year, I'm dressing in all black, and somebody would be like, oh, that's a little bit excessive. But for them culturally, that's the norm.
Right.
So a short answer is it varies, and there's a variety of ways, but it's important for you as clinicians and future clinicians to find out what's the context of this person's culture and the norm within that culture when it comes to bereavement and grief.
Yeah. I think another taboo or difficulty that people experience is also related to talking to their children or younger individuals about death, or if there's a loss in their family. How do I tell the children that the mother is no longer here, or goes to heaven, and what is heaven? So instead of saying they died, So is there a right way? Is there a right time to share those news in a way that it's understood by death and also that helps normalize the conversation about people dying?
Well, and I would say when it comes to talking with children, there's no one right way, but there's some definite wrong ways. And so you've got to communicate at what's age appropriate for children. And so if it's age appropriate to discuss it in a way, because at a certain age, developmentally, children don't understand time. So when you say, you know, this person's gone, they're like, okay, so when are they coming back? And it's like, but they're not gonna come back. But why not? Like, well, because they died. And then the child's like, well, what does death mean? They have no real concept of what death really means. So you have to speak in terms that are age appropriate. And sometimes, you know, depending on what somebody's belief system is, if they're Christian and they say, you know, grandma or grandpa went to heaven, they say, well, can we go and visit? And amazingly enough, we have, and this is a side note, but it fits with what you're asking. We have this thought that like young children don't think about committing suicide. But the youngest child that I know that tried to commit suicide was 4 years old. And it was a 4-year-old's attempt in the mind of a 4-year-old, but her father had died. And they told her that, you know, he died and he went to heaven. And so she knew that there were certain things that are dangerous that would cause you to die. And so what she went and did is she went to lay into the street to get ran over by a car because she was like, I want to go be with my dad. Wow. And so that's a suicide attempt in the mind of a 4-year-old. But that's when you have these conversations where they understand loss, they understand the feeling, but they don't necessarily understand the concept. And so when you talk about how do I discuss this in developmentally appropriate ways, you start with the feeling and then you work developmentally as they grow in talking about the concept. And children don't speak about their feelings easily. So it's not just if you ask a child, how do you feel? The response is usually fine. But they don't talk about the experience of loss and the feelings behind loss easily. So one of the ways is talking about the person who died and sharing from example of what it means for you to have lost that person so that then the child can follow suit. And again, that changes depending on where the age range and where a child is developmentally.
And I think it puts a lot on the adults to be very mindful about that, especially when it comes to talking about that. If they already have difficulties talking about it, if they already have difficulties expressing their feelings or being mindful about their own feelings, it's going to be a lot harder to talk and raise a child that is mindful about their feelings and understand that in that way too.
And the child follows suit. A lot of times you guys spoke on that piece of it being taboo to talk about death and loss. So a lot of times when somebody has died, there's this, oh, we're not going to mention them anymore. Right. And so when children learn that as the norm of let me just not mention this person anymore, then again, they're having to go through that pain of loss by themselves instead of being able to process it with a parent. I have a family that I'm working with or I've worked with where, you know, they lost their father. And it's been hard for all of them because it was a sudden and unexpected loss. And the children hadn't spoken about the father at all. And so the mom was like, I need to get them to process this. I need to know what's going on with them. But it was hard for her to talk about too. And so in the context of therapy, it opened the door for them to say, yeah, I think about him every day. And then to start sharing not just the memories of the death, but the memories of the life, because it's the life that made the death so significant.
Sure. So, Doctor, I'm kind of jumping ahead a little bit, but with you sharing that, it just makes me think from the clinical piece, when you have an individual, whether they be adolescent or adult, who is really suppressing some of these feelings or maybe have been for such a long time, what are some clinical ways that that you feel is helpful to start to try to open up that box and open up some of those emotions that really have been pushed down?
So I think very much it depends on clinical style. But I think very much, first and foremost, no matter what your clinical style is, you do have to follow the pace of your client. And so you don't, similar to trauma, you don't force someone to talk before they're ready. But you do acknowledge some of the feelings behind why it's difficult to talk about. And then I think that that kind of opens the door to then talking about the actual experience of loss. But going back to it being, you know, different stylistically, as clinicians, many of us vary in terms of our spectrum of self-disclosure. And so there's some people who are like, I'm not disclosing a single thing. And then there's others who are like, okay, I'm going to use self-disclosure for the purpose of moving therapy along. Right. You should never self-disclose for the purpose of sharing your own stuff, because go to your own therapist for that. But I found that the only way especially with children, the only way I've been able to get them to open up is to connect with their loss through my own loss. So when I can look at them and say, you know, this is the lens from where I get it. This is what loss has meant to me. And then they start listening, they start paying attention. And when you're sharing your experience and the meaning behind your loss, you know what resonates with them, because they will stare directly at you and tears will start falling. And that makes them then feel safe enough to say, I'm not the only one. Let me talk about this. Because now there's a trust that you might understand what they're feeling. Because grief is something when you're in it, you feel the depth of it as if nobody else get it. It's like this hollowing effect of drowning where nobody can reach you. And so when you have that one person that says, I've drowned with you, or I'm in that same place, or I've been in that place before, all of a sudden it gives you a moment to take a breath from being underwater.
Right.
So we're talking about how difficult it is, right, to express those feelings when we're going through it in a way that like we should connect with other people. As I guess the other person is listening to it, not necessarily like a mental health professional, but any other individual on the other end of the relationship. How can we help them, or how can we be the one to understand like the grieving process or bereavement process is different, you know, or is it the same for everyone? Like, do we all go through the same stage?
Yeah, and ultimately, so we all talk about the stages of grief, and every person who's trying to cope with loss before they go into therapy, they've Googled and they're like, okay, so I looked at these stages of grief and I think this is where I'm at. And though I think on the one hand, those stages of grief are great because it gives you some context of, if my emotions are all over the place, it's okay because this is a normal grieving process. On the other hand, sometimes people think, uh-oh, I skipped this stage. Should I be there or should I? And so the thing that I try to get everybody to understand is that grief, there's no one right way to grieve, and nobody grieves nobody grieves the same, and nobody can tell you how to grieve. And so letting people own their own right of their own process of their grief is so important. That's why, you know, when I say a client comes in, you meet the client where they're at and what they're ready to talk about. And sometimes it doesn't start with the loss. Sometimes it starts with the life. In fact, more often than not, it starts with the life. And so when somebody comes into therapy and they're not at a point where they're ready to discuss the death of their loved one yet, I ask them, well, can you tell me about them? And to me, this is going to sound really, really strange. I say it to everybody who I work with when it's grief, when we're addressing grief, and I tell them it sounds strange, but I believe that there's so much beauty in loss. There's so much beauty in grief, because the only reason why you grieve is because you loved. And so that love part is a beautiful thing. Grief part is painful, but it's only painful because you've loved. And so when I'm working with somebody, I ask them, tell me about your deceased loved one. And I tell them that that's the way I get to know them, that I've never met that person in my life. However, through them, I still get to know them.
Yeah.
And for that individual who's grieving, it makes them feel so good because they're like, I want my person, I want their life to carry on. And if the only way that they can carry on is by me talking about them, they become more willing to share stories and eventually lead up to what and why the meaning of that loss hurts as much as it does.
So, Ronnie, I don't know if you want to jump in here.
So let me let me just add something to that, because I think that was very powerful, and then take it away, LT. So and I think, Dr. Dixon, that's such a great point, and also inadvertently, as a byproduct for an individual who maybe since the loss has not thought about their loved one in that way, hasn't thought about the stories in a positive way, gives them an opportunity to really like think back and maybe bring a smile to their face for the first time in weeks.
Yeah, very much so. It does make them, because again, loss has, just like any sort of pain, like let's say you have a toothache, every other part of your body feels just fine.
Mm-hmm.
But if you have that toothache, ooh, the only thing that you're focused on is the fact that your tooth hurts, right?
Yeah.
And so grief is the toothache, where everything else, career might be good, friends might be good, but that one loss is the one focus in the moment. And so you're thinking so much about the death that you don't remember all the memories that came before the death. And don't get me wrong, because I don't mean to dismiss, it's that one thing that changed everything, but we can't dismiss the everything that became before the one thing.
Yeah. No, that makes a lot of sense. Yeah. And it's difficult, I guess, for that person to see the whole journey at that point. Yeah. And so thinking about, again, like the stages of grieving or how people cope with death, right? When do we, as mental health professionals, should we say, like, there's a line here, this is normal and this is not normal? I don't want to say necessarily like normal and not normal, but I guess that's the language that people use outside of the clinical environment in a way, but in terms of significant, that's interfering with your life, and that's not necessarily interfering with your life in that way. So how can we draw a line? Is there a way to draw a line, or it's more like lots of curves? And
there's no one line, I will say that, but I will say that there's a need for there to be process and individuals to recognize when additional interventions are necessary. And so for some people, it's like, okay, your grieving is normal. Nothing about pain of loss is abnormal. Nothing about it. When it becomes interfering in one's life, there is this question of, okay, perhaps medication may help because the depression is consuming. Perhaps medication can take the edge off. Perhaps starting to engage in some activities can help. Perhaps, allowing some social interaction will help. So it's not necessarily any normal versus abnormal grieving, as much as it's what is healing versus what keeps you stagnant. Because a lot of times we have this thought that grieving is this process that you go through these steps and then it ends. Grieving never goes away, ever. Never, ever, ever does grieving go away.
Mm-hmm.
But it changes. The way that we carry the grief changes with time. And so initially it might be extremely heavy, and then it becomes a little lighter, but every single day the person carries that grief. And then sometimes it gets triggered to where it can be a year of it being not so heavy, and then there's some sort of anniversary date or a birthday or the holidays that make it just as heavy as it was when you first lost that person. But it's just this matter of not so much is there a normal versus an abnormal, as much as it's what offers healing versus what keeps it heavy.
Okay.
That definitely shifts the way that a lot of professionals can see, or individuals can see grieving. And I know we focus on that here, but later we're going to talk about other ways, or how else we transfer it to. And so I'm wondering, though, and I don't know if Ronnie is wondering too, is it just because people talk about, okay, get over, move on. It's been like 6 months already, and the person has stopped their lives, So I guess from a mental health professional perspective, trying to see, okay, this is bereavement from, this is depression from, this is something else. Like how, in your experiences, how have you been able to navigate that and the other symptoms that can appear as part of the process?
Yeah, there's a way to delineate between it being bereavement versus being depression, because bereavement can turn into major depression. And when that's the case, that's when you start entertaining things like medication. You don't tell them that their bereavement is at this point not normal, but you tell them that their process of healing needs some assistance, whether it's through medication or through the therapy that you may be providing and utilizing different techniques. But yes, as a consequence of death and bereavement, sometimes people experience a diagnosis of then depression and or anxiety and trauma, a number of different things. But yeah, it could be a precursor for the other symptoms. Because for example, when somebody loses someone, they're bereaving and they're going through bereavement, they're grieving. But then when they start losing meaning of life, then it becomes this emptiness to where, yes, the cause of the depression is the loss, but the depression to me is a separate issue with an etiology of losing someone.
Okay. So thank you so much for that, Dr. Dixon. And we've talked so much about death and how to kind of work your way around that in the general population and in the clinical sense. But I kind of want to shift gears a little bit, because there's other ways to feel grief, right? And not just the death of an individual, but we can also feel grief to a significant point with things like maybe a loss in job, right? Or a change in relationship status. So what are some correlations between the loss of an individual and the loss of other things that we feel passionately about?
So this is where we get into why I feel like there's a lack of discussion in graduate school about loss. Because conceptually, when you get the understanding of the thread and the theme of loss in somebody's experience in therapy, it makes the depth of your intervention so much more impactful. And so, like you said, like there's a number of other types of losses, whether it's loss in employment, loss in a relationship, loss of health, loss of friendships, loss from moving, loss from status, socioeconomic status, loss of identity. There's so many variations of loss, and when we look at it through that lens, our conceptual understanding of what somebody's going through is so much deeper. We look at different issues of trauma, such as sexual trauma. There's a loss of innocence, a loss of feeling safe, a loss of a perspective of the world in which there's a picture of, okay, everything around me is okay. And then all of a sudden it's like, no, bad things can happen, and bad things can happen unexpectedly. And so then there's a loss of trust. There's so many variations of loss. And if you look at what's going on in the world right now, any one of the things that are going on in the world right now, but let's go with COVID. Let's go with COVID-19. That has sparked so much, or so many existential crises right now, because there are so many losses connected to COVID-19. And if it's not a already loss, then it's fear of loss.
Yes, and to add to that, just the complexity of that presentation, right? So if an individual, God forbid, loses a loved one, but on top of that, loses a job maybe the previous month, or loses something else that they're very connected to, I think that also comes to mind for me. It's just the compounding of issues and today's presentation.
Well, and even with death, and I wanted to talk about the other one, but even with death, if somebody dies right now during this time, they lose the opportunity, family members lose the opportunity to be with that individual. If they're in the hospital, the hospitals aren't really letting a lot of people in. So there's a loss of even being able to lose that person in the way that you would want to. And then there's the loss of being with that person, and the person who's dying loses that opportunity to have someone with them, and in many cases have been dying alone, which is really sad. But yeah, COVID-19 has brought on multiple losses and layered loss, loss of freedom, loss of viewing the world in one particular way, loss of a feeling of health and safety,
Mm-hmm.
a number of losses.
And as you mentioned in the beginning, like, we don't often talk about, I mean, in general population terms, we don't often talk about the aspect of that loss as something to grieve through, to take time to feel, experience our feelings, check in with our thoughts, and go through the process. I think there's a lot of time people just say, again, get over, go look for another job, just move on, you know?
Mm-hmm.
And again, it just, but I'm feeling this, I'm getting confused, it's telling me to move on, I'm not ready to move on, what am I supposed to do?
Mm-hmm.
So
At times it's dismissive. Mm-hmm.
yes, dismissive, and get to make this message. I mean, like, I'm not even allowed to feel anything. If I do feel something, I can't tell anyone. And then there's this loss of, I guess, the identity, the loss of the ability to even speak, right? Because I'm not allowed to talk my mind, my feelings to anyone. It's really difficult. Not everyone has access to therapy, financial concern, internet difficulties, and whatnot, right? I know we're talking about like the U.S., you know, not just the U.S., but also around the world. A lot of people don't have access to all of this. It can be very luxury, right? It can be expensive. A lot of people don't have health insurance, so loss of the life that they had before. So how do they cope?
Mm-hmm. Yeah, and I think with the coping piece is the hardest part of grieving, because, so let me speak in layers. When it comes to coping with death, it's kind of like, okay, I just do it the best way that I can. People just walk in terms of, okay, how can I get through today?
Mm-hmm.
When it comes with coping losses such as financial, housing, relationships, it's this ongoing journey where some of it is a day by day thing of, okay, how do I just get through today? But there's also these pieces of, I kind of think it connects to that question of, you know, when, what's normal versus abnormal, or when do you cross that line where it's like,
Right.
okay, what can I do in the moment to give myself and bring myself joy? And how do I, at different moments, compartmentalize? Because sometimes there is a need to pause and put the grief in a box, not to stay, because at some point you got to deal with it. But it's like, okay, in order for me to operate in this area, I have to compartmentalize for the moment.
Yeah, and I think with that, a lot of times people have difficulties, and sometimes you see it in movies, and people talking about, like, I don't think they have process, or they've never dealt with the loss. Like, you see somebody, because they have kids, because of variables A, Y, and Z, they are on the go, right? They're still handling a bunch of other things, and then 6 months or 1 year later, they're like, okay, now it's getting to me.
Yeah, and part of that too is, aside from the busyness of life that may keep them from their processing of grief and loss, despite what the loss may be, there's also the readiness. If somebody's not ready, they're like, I can't face this in this moment. And so it might be 6 months later where they're all of a sudden crying out of nowhere, and they're like, where's this coming from? And it's all the built up pain that they had to compartmentalize in order to function for those 6 months that they now are ready to unpack.
Yeah. You put it in a beautiful way now. Yeah. You mentioned too, and Ronnie, please jump into it, because now I'm like taking over. But you mentioned fear of a loss, right? And so we, as mental health professionals, sometimes we talk about anticipatory, like grieving or loss and whatnot. So can you tell us a little bit about this component, I guess, of like the fear and anticipating that, okay, this is going to happen?
Yeah. So anticipatory grief is heavy, because it's one of those things that's like you know it's coming. And so it's constantly, is it today? How about today? And so anticipatory grief carries its own type of weight, because it's a process in and of itself. because it requires coping through the anticipation on top of, or before you can then cope with the actual loss.
Sure.
So anticipatory grief is heavy. So like this comes in the form of when somebody's told they're dying, or they're seeing a company where everybody's being laid off, or they're knowing that the relationship that they're in is coming towards an end. It's just a matter of when. That anticipation causes a lot of anxiety. So I think grief has a heavier, like grief from the loss, the actual loss, has a heavier component of depression. Anticipatory grief has, yes, the depression and the weight of that, but also a component of the anxiety that comes. So yeah, that's a complex aspect of grief. The other thing that kind of touches on too is grieving the loss of somebody who's still here. And this could be in the form of, let's say, dementia, or even in the form of, let's say, family relationships that have ended for whatever reason, where you don't have contact with that family member anymore, or you've severed contact with that family member. So that's this piece of, it's as if the person has died, but they're still alive. And that's a very confusing process, because it carries different guilts of, you know, I'm acting as if this person isn't here, but they are still here, but they're not the person that I knew them to be, or the relationship isn't what I knew it to be.
Yeah, this is such a great conversation, Dr. Dixon. I keep thinking up of new questions, so I'm going to loop back around to something, and I know that we have a few topics that we want to get to before we close, but this keeps coming up for me. And I was reading an article not too long ago, and I'm wondering if you have any thoughts on this or any experience. So it was talking about a complex presentation of grief, right? So losing someone who caused maybe some sort of trauma to you, right? Or losing, it doesn't even have to, or the article itself didn't even talk about specific trauma, but it talked about losing someone who the relationship just wasn't the best with. I'm wondering, from a clinical aspect, and general, of course, is there a certain way to tease apart what comes first? Does the grief come first, or does the maybe anger come first? Have you seen a presentation like that?
So that's a question of which came first, the chicken or the egg, because there's a number of presentations for that. And it's a layered experience where the person may have sadness that the person is gone, may have joy that the person is gone, and then feel bad about having joy that the person is gone. And then they may feel the weight of unfinished business. When I thought I'd have a chance to reconcile this relationship before they left.
Yes.
And then sometimes there's this aspect of they did get a chance to reconcile, but then they're left with the sadness of how come this couldn't have happened sooner? And they're still left having to process on their own the aspects of the relationship that the other person didn't give them closure to. So there's a lot of personal reconciliation that the individual goes through when the relationship wasn't positive.
Right. Okay.
As mental health professionals, what are some approaches that you have used or have shown to be effective when it comes to helping individuals through grief or bereavement and whatnot?
I think that personally, existential humanistic approaches work the best when you're dealing with issues of loss, grief, bereavement, particularly meaning making. And this comes in the form of constructivism. Constructivistic theory is a theory that really dives into aspects of what does the loss mean to you? Because that's under existential, that's under humanistic, because when you do the meaning making, then all of a sudden this loss isn't just a loss that brings on pain, but it's a loss that has a significance, and the greater understanding that you have for the significance, for whatever reason, then gives a person more of a level of peace. So I would say the approach that I always utilize when it comes to processing bereavement and grief tends to be constructivism and meaning making.
Again, those are not necessarily approaches that most schools talk about. And I think maybe in our experience, Ronnie and I, like going to school together, maybe we talked about existential. We also get in the health psych or hospital settings, right? Then we do talk about existential a lot. But I think it depends on us to, read a book, talk to other professionals, get supervision on the matter, to actually learn other approaches such as the ones that you described. Because I think that schools are not necessarily teaching us how to talk about that, talk about laws, and use those approaches.
Definitely, and I'll add to that, obviously loss can happen in any form and at any age. But something that we also didn't speak about that much in the training, and I think is very pertinent, is as our geriatric population is growing, having the ability to connect with them in certain therapeutic practices, such as existentialism, that would be more beneficial to them, maybe than some of these other practices where I think it's easier to grasp the concept of, but in terms of patient population, chances are, as you mentioned in the beginning, Dr. Dixon, we are going to be dealing with this with really every patient in a certain form or context.
Yeah. And speaking specifically about the geriatric population, there is, if you think about developmental stages of life, and you're looking at Erik Erikson's developmental stages and the task at that time in a person's life, it's about meaning making. What's the imprint that I left in the world? And so a lot of research shows that the individuals who are more at peace with their time on earth coming to an end are individuals who feel like they've reconciled or have an understanding of what is the imprint that I've left for the next generation. But when there's these feelings of, I don't know what my meaning of life is, I don't know what my purpose was, I don't know that I left any imprint in the world, that's when somebody's like, no, I still need more time. There's more for me to do.
And the other component I think that we don't talk about as much in general, if you're not necessarily like working with dying patients or patients with what we would say like quote unquote closer to dying, because of the developmental stages and whatnot, it's dying with dignity. And because of, again, of developmental stages, or other neurocognitive disorders that might take place among the elderly, then a lot of the dignity is taken away from them. And there comes depression, comes sadness, it comes anxiety, and loss, right? Loss of identity, loss of feeling independent, autonomy, and not being involved in their own process of choosing how to die. And, and the last days or last months or last years of life, because maybe a family member or somebody else who is around them all the time is actually making all the choices for them. And so take away the dignity. And so I think through therapy, I think it's important to bring that back to them too.
Yeah. And I think like the dying with dignity, when we talk about things like euthanasia, and that's such a conflicting, people have very conflicting, strong thoughts on it.
Sure.
And a lot of times I think you don't know what it's like unless or until you're in that position, or somebody that you love who's very close to you is in that position. And so the concept and the idea of dying with dignity, to me, I think the piece that comes closest to it is hospice, in terms of allowing people to have comfort before they pass. However, one of the things that frustrates me so much is people have a misconception of what hospice is. Yeah. If I hear one more person say, hospice kills your family, it doesn't. That's not the intention of hospice. That's not what they do. They're like, don't give them the hospice meds. That's injecting them with poison so they'll die sooner. No, the person goes on hospice because they are dying. Nobody gets on hospice who's healthy. They get on hospice, and they don't even get on hospice because they have a chronic illness. They get on hospice because they have a terminal illness,
Mm-hmm.
which means they're dying and they're about to die. And so people sometimes have this misconception where they're like, everybody who goes into hospice dies. Yeah, because they were dying. So I think it's important to clear up this, misconception that hospice kills people. That's not what it does. What it does is that it makes people as comfortable as they can be as they're dying so that they can die with dignity.
Yeah. And I worked with patients in the hospital setting before, or know a lot of people in that arena. It's just that a lot of times they feel the patients feel so alone. Nobody else, people stop visiting them, right? And then I think sometimes to bring back the dignity is just stopping by to see them, because it brings them a feeling of connectedness, right? And that somebody still cares about them, no matter who is showing up for them. Yeah.
And purpose is the key piece. Mm-hmm.
Yeah, exactly. And little things as maybe like reading a book or talking to them or just sitting next to them for a few minutes, right? Those things do matter for them. And again, it just instills a little bit of calmness and other feelings associated with that. Sure.
There's something that's so powerful yet so painful about talking to someone who is in a position where they know they're dying. Because the things that they share and the place that they're in and the feelings that they have about knowing that, there's that anticipation of my time here is coming to an end. There's something so powerful about those types of conversations, but a lot of times the conversations that somebody while they're dying wants to have, people try to hush them and say, no, let's not talk about that. You're here. And the person wants to say, yeah, I'm here, but I'm going to die. Like I feel it in my body and I know it's coming. And when you let that person talk about their process of knowing that their death is coming, there's something so powerful yet so painful about that conversation. And I think it's both the power and the pain that keep people from wanting to actually have it.
Yes. And then as mental health professionals, we will at some point or another, most of us will talk to somebody who is experiencing that moment, if you haven't already. And then so how can we also process, I guess, the loss of our clients, right? We don't often talk about that, like losing clients because of death, and also other losses, right? That clinics shut down, COVID-19, and whatnot, because that poses barriers to how we access or we can continue to give treatment.
Yeah, fascinating enough. We don't teach much about loss, but our whole profession is, built on a concept of loss. Meaning you start with a client, but your intention is not to be in that client's life forever. So at some point there's a beginning, middle, and end, and they leave. And we're a profession of relationship. And so you build relationships with the clients that you have. Now, mind you, they're professional and appropriate relationships, but they're relationships nonetheless. And so when that person then leaves, you yourself are left with different feelings of, okay, I can be proud of the work that I did with that client. I can be proud of the work that they did in our journey together. I can be, excited that they allowed me to be a part of their journey. But then you're kind of left with the what next? Right. And you've got to reconcile as a clinician in your own way, that understanding that you did your part planting a seed or watering a flower, and then just trusting that it'll continue to grow. And then just kind of being comfortable with your role in that beginning, middle, and end in people's lives. And I think that when it comes to the death of a client, because again, we don't talk about loss, but we deal with the populations where suicide is a risk. And we don't talk about the experience of, what it means when a client commits suicide, because that is a major emotional roller coaster, because you go through in your mind, is there something that I missed? Is there something that I didn't do? Am I inadequate? Is their death my fault? And that's a loss in a number of ways. One, the person's life. And then on a professional level, it's this loss of confidence in your abilities. And how do you then regain that confidence? There was something else I was going to say, but I don't remember it, so I'll stop there.
I mean, you teach and you've taken classes, right, helping students grow within this subject matter here. So what could be some exercises that we can, I guess, do to work on ourselves so that we feel we have a different connection with the topic?
I think one of the things that I do when I teach my death, dying, bereavement, and loss class is I start off with students having to come up with a lossography, which is ultimately listing all of the losses in their lives. And fascinating enough, every single class, every single student is like, oh my God, I have a lot of loss. And then they start looking at the different losses, and each one of them carry different weights, but they start looking at the different losses, and then it starts explaining how and why they navigate through life in the way that they do. And so I think that one space to start with is yourself. And I believe this wholeheartedly when it comes to being a clinician in general, is that you got to start with an understanding of yourself before you can understand another person. But when it comes to understanding and conceptualizing loss in other people's lives, it's important to first take your own inventory. And once you do, it makes it a lot easier to recognize the themes of loss in other people's lives.
I wish I had done that exercise. I will definitely work on it, as scary as it sounds, because the whole idea again of facing and thinking about your losses, it can bring some anxiety and feelings. Nevertheless, it creates, it's so important, right? It makes it even more important because of that fear already, because of those emotions that come through as we just hear about the idea of doing this exercise.
Yeah. Yes. That's such a powerful exercise, and something that anybody can do, right? It's very simple, but it's so powerful, because how many times during our life, during a week, a month, a year, do we actually sit down and take inventory of what we lost over the past year, what we lost over the past month? And that speaks to a little bit also of our culture, moving, always on the go. It's in the past, leave it there. But such a powerful tool, Dr. Dixon. Thank you for sharing that with us.
Yeah. And I think as mental health professionals, we often talk about journal when it comes to even like, what are you eating, right? Or some of your thoughts and etc. throughout the day. I don't think we focus on so much writing about the losses per se and how you create meaning about those losses, and what does that mean right now in your life, which can then interfere with how you cope with losses in the future.
Yeah, completely. And one of my colleagues, in fact, she recently wrote some journals that she developed to kind of help people in their process of mental health.
Yeah. So there's so much more. I hope you guys have enjoyed our conversation today. Dr. Dixon, before we finish, do you have anything else you want to add? And also, how could our listeners, our audience, get in touch with you if they want to?
So the first thing that, just to add and for me to close out on is just, my hope for people is that they become more comfortable with the discomfort of talking about loss, because doing so is so freeing. And I hope that people begin to see the beauty in grief, because we only grieve because we've loved or because something was important to us. And to me, whatever happened before the loss is beautiful. And then the last thing that I want to say is what I remember I was going to say, which is, when it comes to hope, you all as grad students, myself, when I was a grad student, the one thing that we're taught is to instill hope. And when you're talking to somebody when they're in the process of dying, the question becomes, how do I instill hope? And I say you can't instill hope that things will get better when it's a terminal illness. But what you can instill hope in is that their life had meaning. And that's why when you're doing grief work, meaning making is so important. And so you asked, I think, where people could reach me. I think. Yes. So if you want to contact me, if you're interested in therapy or want to hear more, I'm on social media. On Facebook, you can find me at Dr. Patricia S. Dixon. On Instagram, it's Dr. Patricia Dixon. And then I have a website, which is www.patriciasdixon.com. If you can tell, there's a theme, and it's my name with my middle initial in some cases. And then the final thing is that I do have a podcast of my own called Healing Mentality.
Yeah, So we'll definitely add how they can contact you, like your handle and social media and website and whatnot in our episode description on our podcast and also social media. So if you didn't get that, you can find out more information because we're also going to be tagging her. So thank you so much for joining us today, for helping us grow and become better professionals to, just thinkers about the topic and also the way that we feel about losses.
Thank you for having me.
And I just want to say, if you guys want to stay Psyconnect with us, we are on Instagram, Facebook, and Twitter. Let's Psyconnect, all one word, the lowercase. And if you want to get in touch with us, send us an email, discussion@letspsyconnect.com. And remember, let's Psyconnect.